Did you know that a persistent sore throat or a slight change in your voice could be early warnings of something much more serious? And learn how recognizing these signs early could save your life. Head and neck cancers cover a variety of malignancies originating in the mouth, throat, nose, sinuses, salivary glands, or larynx. These cancers often manifest with subtle symptoms that are easily dismissed or attributed to less serious conditions. However, early detection is crucial for successful treatment and improved survival rates. By understanding and recognizing the early signs of head and neck cancer, you can seek timely medical intervention and increase your chances of a positive outcome. To grasp the complexity and seriousness of head and neck cancers, it's essential to understand the anatomy involved. The head and neck region includes numerous vital structures, each with its specific function. These structures include the oral cavity, pharynx, throat, larynx, sinuses, nasal cavity, and salivary glands. Cancers can develop in any of these areas, leading to a diverse range of symptoms depending on the tumor's location. Imagine finding out too late that a simple tip could have saved a loved one from a serious health issue. Don't let that happen to you or your family. Share this video with your friends and family right now to keep them informed and protected. And make sure to hit that subscribe button so you never miss out on crucial health information. Your health matters to us, so leave a comment below if you have any questions or need more information. Let's get into the video. Common early symptoms. One of the most common yet easily overlooked symptoms of head and neck cancer is a persistent sore throat. Unlike the typical sore throat caused by a viral infection, this discomfort doesn't resolve with standard treatments or rest. If a sore throat lingers for more than 2 weeks without improvement, it's crucial to consult a healthcare professional for further evaluation. A sudden change in voice, particularly hoarseness, can be an early indicator of laryngeal cancer. While voice changes can occur due to various reasons, such as vocal strain or infections, persistent hoarseness lasting more than 3 weeks warrants medical attention. Early-stage laryngeal cancer often presents with this symptom, making it vital to investigate any unexplained changes in voice quality. Unintentional weight loss is a red flag for many types of cancer, including head and neck malignancies. If you notice a significant drop in weight without changes in diet or exercise, it's essential to seek medical advice. Weight loss in these cases may be due to difficulty swallowing, dysphagia, decreased appetite, or the body's response to the presence of cancer. Difficulty swallowing, or dysphagia, can result from tumors obstructing the throat or esophagus. This symptom may manifest as a sensation of food sticking in the throat, pain while swallowing, or regurgitation of food. If you experience persistent difficulty swallowing, it's crucial to undergo a thorough examination to determine the underlying cause. Ear pain, especially when not associated with an ear infection, can be a symptom of head and neck cancer. This type of referred pain occurs due to the close proximity of nerves in the head and neck region. Persistent ear pain, particularly if it affects only one ear, should be evaluated by a healthcare provider to rule out malignancies. The presence of a lump or mass in the neck, throat, or mouth can indicate the development of a tumor. These lumps may be painless initially, but should not be ignored. Enlarged lymph nodes or growths that persist for more than 2 weeks require medical attention to determine their nature. Chronic nasal congestion or obstruction, particularly on one side, can be a sign of nasal cavity or sinus cancer. If you experience persistent congestion, frequent nosebleeds, or a reduced sense of smell, it's essential to seek a medical evaluation. These symptoms can often be mistaken for common allergies or sinus infections, delaying a potential diagnosis. Mouth sores or ulcers that do not heal within 2 weeks can be indicative of oral cancer. These sores may appear on the tongue, gums, or lining of the mouth and may bleed or cause pain. Regular dental checkups can help identify abnormal lesions early, facilitating prompt intervention. Risk factors. Understanding the risk factors associated with head and neck cancer can aid in prevention and early detection. Some of the primary risk factors include tobacco use, including smoking and smokeless tobacco, is the leading risk factor for head and neck cancers. The harmful chemicals in tobacco can damage the cells lining the mouth, throat, and larynx, leading to cancerous changes over time. Excessive alcohol consumption, particularly when combined with tobacco use, significantly increases the risk of developing head and neck cancers. Alcohol can act as a solvent, enhancing the absorption of harmful chemicals in tobacco and increasing their carcinogenic effects. In recent years, HPV infection has emerged as a significant risk factor for certain types of head and neck cancers, particularly oropharyngeal cancer. HPV-positive cancers tend to have a better prognosis than HPV-negative ones, highlighting the importance of vaccination and early detection. Head and neck cancers are more common in older adults, with the risk increasing with age. Additionally, men are more likely to develop these cancers than women, possibly due to higher rates of tobacco and alcohol use. Poor oral hygiene and chronic irritation of the mouth lining can increase the risk of developing oral cancers. Regular dental checkups and good oral hygiene practices are essential for reducing this risk. The importance of early detection. Early detection of head and neck cancers significantly improves the chances of successful treatment and long-term survival. When identified at an early stage, these cancers are often treatable with surgery, radiation, or a combination of therapies. However, many cases are diagnosed at advanced stages, where treatment becomes more challenging and less effective. Screening for head and neck cancers involves a thorough examination by a healthcare professional, including visual inspection, palpation of the neck and throat, and potentially imaging studies or biopsies. Regular dental checkups and self-examinations can help detect abnormalities early, prompting timely medical intervention. Advances in medical technology and treatment options have improved outcomes for patients with head and neck cancers. Minimally invasive surgical techniques, targeted therapies, and immunotherapies have revolutionized cancer treatment, offering new hope for patients and their families. Preventive measures. While not all head and neck cancers can be prevented, adopting certain lifestyle changes can reduce the risk of developing these malignancies. Key preventive measures include: the most effective way to reduce the risk of head and neck cancers is to avoid tobacco and excessive alcohol consumption. Quitting smoking and limiting alcohol intake can significantly lower the risk of developing these cancers. Practicing good oral hygiene, including regular brushing, flossing, and dental checkups, can help prevent oral cancers. It's also important to address any dental issues promptly to avoid chronic irritation and potential cancerous changes. HPV vaccination is a crucial preventive measure for reducing the risk of HPV-related head and neck cancers. Vaccination is recommended for both boys and girls before they become sexually active, typically between the ages of 11 and 12. Exposure to ultraviolet UV radiation from the sun can increase the risk of lip cancer. Protecting your lips with lip balm containing sunscreen and wearing a wide-brimmed hat can help reduce this risk. Conclusion. Recognizing the early symptoms of head and neck cancer is vital for timely diagnosis and effective treatment. A persistent sore throat, voice changes, unexplained weight loss, difficulty swallowing, ear pain, lumps, persistent nasal congestion, and non-healing mouth sores are all potential warning signs that should not be ignored. By understanding the risk factors and adopting preventive measures, individuals can reduce their risk of developing these cancers and improve their chances of early detection and successful treatment. Remember, early detection can save lives. If you or someone you know experiences any of these symptoms, don't hesitate to seek medical advice. Stay vigilant, prioritize your health, and spread awareness about the importance of recognizing the early signs of head and neck cancer. Your proactive approach could make all the difference in the fight against this often overlooked group of cancers. Thanks for watching. Remember, the health of you and your loved ones is invaluable. If you found this video helpful, don't keep it to yourself. Share it with your friends and family to ensure they have the information they need to stay healthy. If you haven't already, hit that subscribe button and click the notification bell so you never miss out on our latest health tips. Your feedback is important to us, so leave a comment below with your thoughts or any questions you might have. Stay healthy and informed, and we'll see you in the next video.